This question deals with a 38-year-old Caucasian male is being evaluated for an episode of painless hematuria. Painless hematuria. He has no significant past medical history. Intravenous pyelogram shows multiple cystic dilatation of the medullary collecting duct. So the collecting duct in the medulla, so this is the cortex and the medulla, the collecting duct in the medulla is going to have cysts, cystic dilatation, okay, in otherwise normal kidneys. So everywhere else is normal, it's only in the collecting duct of the medulla this kind of cystic dilatation happens. The patient is at highest risk for which of the following? Now, whenever we hear painless hematuria, two things jumps to me right away. One is renal cell carcinoma. The other is transitional carcinoma of the bladder. But this kind of cystic dilatation is not seen in either. So this is not renal cell carcinoma or transitional cell carcinoma. Really, this is a very common and benign condition. This is actually called medullary sponge kidney. Okay, so in medullary sponge kidney, it's characterized by the cystic dilatation of the medullary collecting duct, but it spares the cortex. See, that's why it says in otherwise normal kidneys. It spares the cortex, but there is cystic dilatation of the medullary collecting duct. These patients often are going to be asymptomatic. Etiology is unknown, patients are asymptomatic, and usually they're picked up on routine exam. For exam, an intravenous pyelogram is going to pick it up. However, certain things can happen. We can have some problems due to medullary sponge kidney. There is going to be kidney stones. Kidney stones is going to cause this hematuria and UTI. Both of them can happen due to the kidney stones. It is the most common complication of medullary sponge kidney. In fact, 90% of the people with medullary sponge kidney is going to have kidney stones. And people who have kidney stones, 12% is going to have medullary sponge kidney. So that's how common this is. Okay? So now that we understand a little bit about the question, let's see if we can answer the following. We can choose an option from the following. The question says the patient is at highest risk for. The highest risk for medullary sponge kidney is going to be kidney stones. They can also have hematuria because of kidney stones. They can also have UTI, but the highest risk factor is going to be kidney stones. So B is the obvious choice. What about choice A, chronic renal failure? Chronic renal failure, the most common cause of chronic renal failure in US is actually diabetes. So that does not cause, medullary sponge kidney does not cause chronic renal failure. If they do, it's because of a secondary cause. Either they developed such a bad UTI or such a bad obstruction that it can eventually lead to chronic renal failure. So A is not the best answer here. Other diseases which can also cause chronic renal failure is going to be adult polycystic kidney disease. Okay. What about neoplasia? Can medullary sponge kidney cause neoplasia? No, it's a benign condition which I mentioned earlier. So this is MSK. Neoplasia is not a complication of MSK or medullary sponge kidney. The other option seems a little far-stretched. Nephrotic syndrome, cerebral berry aneurysm, that is due to adult polycystic kidney disease. Hepatic fibrosis, those are not related to medullary sponge kidney. So in this case, the answer is going to be kidney stones, B.